Hello everyone, happy Friday. I'm Jeanna Miller, the Environmental Health Manager here at the Missoula County Health Department. I'm also the Order Compliance and Interpretation Group Supervisor for our Incident Command Team. I'll be delivering the daily briefing today. In addition to providing updated case counts, I'll be providing information tailored for businesses about local and statewide face covering or mask rules, and hopefully answering some of the most frequently asked questions that we've been compiling for the last couple of weeks. Let's start off with the most recent numbers. We've had 199 cumulative positive cases in Missoula County to date. 196 of those cases were identified by testing and 3 were epi-linked. We've had 144 recoveries and 1 death. 1 Missoula County resident and 5 non-county residents are hospitalized in Missoula County. We have 54 active COVID-19 cases with more than 290 close contacts. Active cases and their known contacts are in quarantine and isolation and will continue being monitored and supported as needed. The state of Montana is reporting 3,039 cumulative COVID cases, which is up 129 cases from yesterday. There are now 1,178 active cases with 56 active hospitalizations across the state. There have been 46 deaths related to COVID-19. 49 of Montana's 56 counties have had and currently have active cases, indicating that COVID-19 is directly impacting nearly 88% of our state, while other counties without cases are undoubtedly experiencing similar effects to their health, safety, and economies due to the novel coronavirus's wide reach. So to continue maintaining health and safety across the state, I'd like to talk about what we can do here in Missoula County to comply with the local face covering or mask rules, the health officer order, and the state directive, with specific regard to health and safety in our local businesses and licensed establishments. But before I get into the nitty-gritty of the face covering rules and requirements and enforcement, I really want to recognize our amazing business community in Missoula and in the surrounding rural areas of our county for working together with the department, your staff, and customers to make wearing face coverings part of your daily operation. The proportion of folks in our county who are doing their part to protect others is very high. Business owners have had to adapt to ever-changing conditions as our state and county navigate this pandemic, and you have done so with exceptional grace and resilience. We just really want to thank you for that. So to start off, I want to explain a little bit about how the Health Board face covering rule and the Companion Health Officer order work together with the governor's statewide face covering directive, which was issued a couple days after. The local and state rules are really very similar, but we've had questions from folks about how they're supposed to know which one applies. And really the answer is both. In instances where the rules aren't consistent, the more stringent rule applies. And a great example of that is the age at which a face covering is required. Though our local order set the age at 12 years old and up, the governor's directive is for people 5 years of age and up. So now we go with 5 years of age as it is more restrictive. Other differences include the fact that the governor's directive allows for face shields as an automatic or alternative to face coverings or masks, but the Missoula County rule does not. Face shields are not allowed as a face covering alternative unless the local health officer and Board of Health amend and approve their order and rule. In addition, the governor's directive is only in effect in counties that have 4 or more active cases. This also does not apply in Missoula County. The face covering rule is in effect in Missoula County until further notice, and it's not dependent on active case counts. Finally, in Missoula County, face coverings are required in non-public facing areas of businesses, government offices, and other indoor public spaces, except when staff are able to continually maintain at least 6 feet of space between individuals. This is different and more stringent than the state rule, and we've gotten a lot of questions about this. There's sometimes a misunderstanding that if there are certain areas of the business or times of day when the public or customers are not in the business, store, or office, then the employees are not required to mask up. This is just not the case. Employees are just as susceptible to transmitting or contracting the virus amongst each other, regardless of the public being present in the space or not. In fact, our case investigators show that spread among work teams and groups of employees is one of the ways we end up with cluster outbreaks, which is a number of cases associated with the same space or work environment or work team. But it's true that if your business doesn't have any opportunity for anyone other than staff to enter, either by chance or by appointment, then masks are only required in situations where employees may be within 6 feet of one another. This may include instances like shared vehicles, hallways, check-in stations, shared restrooms, or areas where employees enter or exit the building. All right, absolutely one of the most commonly asked questions is, what are we supposed to do if a customer or patron or guest comes in without a mask on? First off, it's important to know that this is going to happen. It likely already has. So some of you may have plans and protocols in place. But there are two things that you should do. And the first is be proactive and preventative. Do as much as possible up front to set a clear expectation to all members of the public by posting signage and ensuring that all staff wear face coverings or masks at all times. Remember that a conspicuous sign at the point of entry helps set your establishment up for success, and this sign has to clearly state that a mask or face covering is required for ages 5 and up. The second thing you should do is develop a business-specific plan to address guests, customers, or patrons that are not wearing a face covering or a mask. This might include stationing a staff person near the entry areas to remind people, providing masks if somebody forgot one, if you choose to do that. It's much easier and more protective of others to address the issue when and where people are entering rather than after they have browsed in your space or interacted with others for a longer period of time. It's also important to note that what works for one business may not work well for the next. We suggest approaching this issue from the same stance you would any other rule in your business. If you do not allow backpacks in your retail space, for instance, how would you approach a person who is carrying a backpack through the store? Or if you do not allow flash photography in your gallery, what steps do you take if a person continually uses their flash on your artwork? Share and discuss your plan with all staff members so that they're able to follow your protocol when they encounter customers without face coverings. You might even want to practice or talk through some of the hypothetical situations to better prepare all staff for how you will consistently and carefully ask customers to comply with the local orders. So what if a customer says that they can't wear a face covering for medical or personal health reasons? If somebody indicates that they have a personal, private reason that they can't wear a mask, you have to provide them an opportunity to access your products or services in a way that is fair to that individual, but also protects others in the space. Businesses should explore and develop alternative options for people who are not wearing a face covering, like online shopping, curbside pickup or delivery, outside seating, or methods to ensure strict physical distancing from staff and other customers if the service can't be provided without allowing the person inside the space. I want to talk a little bit more about signage related to personal or private health reasons. We've seen and been asked about signs that are posted in our community that indicate that any person not wearing a mask will be assumed to have a serious health condition that precludes them from covering their face. These signs are not in compliance with the rules and also give the incorrect impression that individuals who are claiming a health exemption from masking are allowed to be in the space in the absence of other protective accommodations. So what if a customer or patron just refuses to wear a mask? You approach them and they don't indicate that there is any personal or private health reason or medical condition. They simply refuse to wear a mask. If that's the situation you find yourself in, it is the responsibility of the business operator and or the employees that are on site to not allow that person to enter or remain in the public space. You can choose to offer the goods or services in an alternative way, which is probably similar to what you would offer a person with a personal health exemption claim, but it's not required. A person who refuses to wear a mask is not entitled to accommodations or access to the business. So what about your staff? Staff is a little bit different. We recognize that staff may also be unwilling or unable to wear a face covering or a mask while at work. And this situation, again, is different than the situations described for customers. So if a member of your staff tells you that wearing a mask is unsafe or impossible for them, as employers, you must engage in a conversation with that employee to identify a safe, reasonable accommodation for whatever work setting they are in or tasks that they're responsible for. Options may include working remotely, wearing a face shield, or shifting the employee to a workspace that is separated from the public and physically distant from other staff. On the other hand, if an employee can but refuses to wear a face covering, then the business, government entity, or person in charge of the indoor space must require them to comply. While we are not in a position to provide legal advice or human resources expertise, we suggest that you address this situation in the same manner you would if an employer refused to follow any other critical workplace rule or policy. All right, we'll move on to questions about complaints and enforcement. I'll start with some information about complaints. Since these rules went into effect a couple weeks ago, the department has received over 300 citizen complaints related to face coverings. Staff is working very hard to respond to each one of these complaints. Our focus is always on providing resources and education to business owners and helping them find creative and compliant solutions that work for their unique setup. We want businesses to know that while we take and follow up on all complaints, we do not intend to penalize businesses that are doing their best to follow all of the requirements. If we receive a complaint about your business that describes a single instance of a shopper's mask slipping below their nose in aisle 17 at approximately 7:34 p.m., and yes, we absolutely get those kinds of complaints, sure, we're going to let you know about that. We find that there's a lot of value in reaching out to our local business owners as often as possible to provide opportunity for dialogue and to help you troubleshoot issues you may be having with enforcing this rule within your space. Most of our complaint investigations really result in a better understanding and increased protection for our community. We always start with a conversation first. So what about enforcement? If we find that a business or a government entity is consistently or intentionally not following the face covering requirements, despite us reaching out several times to provide guidance and resources, we will take additional enforcement steps. This might include violation notices, written individual orders to comply or close, or pursuing compliance through the court system. So another question we get a lot is who enforces the mask requirements? Is it the police or the sheriff's deputies? And the answer is no, it's health department staff, as I mentioned before. There have been several questions from business owners and the public regarding law enforcement's role, but I can't stress this enough. Do not call the police or 911 to report a violation of the mask mandate. I'll say it one more time. Do not call the police or 911 for a violation of the mask mandate. Call the Environmental Health Department. Our number is 258-4755, and I'll repeat that at the end of this briefing. It was never the intent or expectation that our local police or sheriff's deputies would be responding to complaints about violations of the face covering rule. However, as always, as was the case before the mask mandate and will be the case after, if a customer or person in your business is threatening you, is abusive or is violent in any way, or is refusing to leave your establishment after you're telling them to leave, call law enforcement. That's the right and appropriate time to involve our local law enforcement officers. One more very important alert related to our enforcement process. We have heard from local businesses that they've received calls from individuals reporting to be from our department, attempting to collect on fines or fees associated with violating the face covering order. Our staff will never do that. Our staff will never call you to collect fines. Do not pay the requested money and call the Environmental Health Division right away to let us know that you've received a call of this nature. Our interest is always in finding a tailored solution that results in sustained compliance and increased community protection. It rarely involves fines or citations. And the last thing I'll mention is that there is an up-to-date FAQ, frequently asked questions document on our website that includes several other frequently asked face covering or mask questions and the answers to those. If you want that additional information, check that out on our website or give us a call on environmental health. Again, our number is 258-4755. That's it for me today. Thanks very much for watching, and everyone have a great and healthy weekend.